welcome to Community Insight Broadcast, a ministry of Churches Outreach Network. I am your host, Denisha Harris, and we have the pleasure to have a special guest joining us here today, Reverend Rhonda Grant Jordan. She's here with us to talk a little bit about a volunteer opportunity that she has for the community. And before we get into that, I'd just like to say welcome.
Thank you so very much. It's a pleasure to be here.
Wonderful, wonderful. Now, Rhonda, I've known you for a bit of time.
Yes.
As you've been in the Greenville-Pitt County area for a while.
Yes, I have.
So we know that you've been involved in community work, and you have been definitely a community leader here in the Greenville-Pitt County area. So we just want to thank you for your service.
Thank you very much.
Yes, but today you have a particular volunteer opportunity that you've had the opportunity to work on and to work with. You are the actual 2019 chair of the Women in Health Luncheon. Is that correct?
Yes, I am.
Wonderful. Can you tell us a little bit about the Women in Health Luncheon and the organization associated with it, the North Carolina Med-Assist Association?
I'll start with North Carolina Med-Assist because that is the reason why we are having the luncheon.
Wonderful.
North Carolina Med-Assist is an organization that provides prescription medications for people in North Carolina who are uninsured or underinsured. And what it does is ensures that people have the opportunity to get the life-saving prescriptions that they need. Because oftentimes if people are uninsured or underinsured, they have to make the decision whether they're going to get other necessities versus getting their prescriptions. So you have people who need medications for high blood pressure or diabetes who are unable to purchase them, which in turn affects their lives and their livelihood. So with North Carolina Med-Assist, which is located in Charlotte, North Carolina, what we try to do, or what they try to do, is to ensure that the people of North Carolina have the opportunity to have the prescriptions that they need. And that is something that I'm very excited about, that is now in Eastern North Carolina, and that we're working with them to ensure that the people of Eastern North Carolina have that same opportunity. The luncheon that's going to be held will be held on May the 22nd. It's going to be at the Greenville Hilton, and it's the inaugural event. There's never been a women's luncheon here for Med-Assist before in Eastern North Carolina. So we're really excited to have that here.
Great. Well, thank you for providing that introduction into Med-Assist and also a little bit about the luncheon. So it sounds like North Carolina Med-Assist is a very important organization for North Carolina and for Eastern North Carolina. And can you tell us a little bit about the impact of North Carolina Med-Assist in North Carolina and how they've been assisting individuals so far?
Yes, currently with 2019 statistics, there are 1 million people in North Carolina who are uninsured. And if you look at that number, that means that there are people who are not receiving their medications. Last year, Med-Assist made a big impact in providing 15,000 North Carolina individuals with medications. And that may be a drop in the bucket, but that's 15,000 people who received the medications that they need. So it has a big impact, and we want to continue to have that impact throughout Eastern North Carolina as they have done in the western part of the state.
Great. So there may be some individuals listening who may need assistance with receiving medication, may need assistance with figuring out how they're going to pay for that prescription medicine that they need. I understand that you have a mobile pharmacy that they can obtain maybe for those prescription medications. How can they get involved, and how can they take advantage of some of the assistance that North Carolina Med-Assist has?
Well, we were fortunate about 2 weeks ago to have a mobile pharmacy at St. James United Methodist Church in which anyone could go and receive over-the-counter medications, Tylenol, things like that they have, and they don't have to qualify based on income or insurance. Anyone could have obtained those. For individuals who are interested in the program, what they need to do is go to the North Carolina Med-Assist website. www.ncmedassist. And so what they will do is the website will come up, and there's an application that they can click on the link and complete the application. Or if they don't want to do that, they can come to Jarvis Memorial United Methodist Church, and we do have the applications for people there. They can just come in, pick them up, complete the application, and send it in themselves. And what will happen, North Carolina MedAssist will contact them, let them know if they qualify, and then they will begin receiving their medications through the mail. They won't even have to go to a pharmacy. They'll get their prescriptions for a year, and then after a year, they'll need to requalify. But it's a wonderful thing, and some people are skeptical about it, that there's a hitch, but there isn't. It almost seems too good to be true, but it is true, that if you qualify, and no one has to know that you're getting your prescriptions through North Carolina MedAssist, but it's a wonderful thing, and it's for adults, children, and seniors.
Great. So for those listening, for adults, for children, and seniors, you can apply for North Carolina MedAssist assistance to receive your prescription medications. And all you need to do is fill out an application. And that application is available online at northcarolinamediassist.org. And also, if you would like to meet face-to-face or pick up an application in hand, you can go to Jarvis Church, and you can receive an application there. Can you tell us where Jarvis Church is located?
Jarvis Church is in a very convenient location. We're downtown Greenville. Our address is 510 South Washington Street. So if you come by, the staff, the receptionist at the front desk will know what you need and be able to hand you an application. All you have to do is ask for one. And any information, they have leaflets or flyers there for you. So pick that information up and then just complete it and send it in.
Wonderful. So does North Carolina MedAssist have an office in Greenville or in Pitt County, or is it basically at the church where you need to pick up your application?
They do not currently have an office, but that is something that is coming because they are expanding to this area. But currently, you can pick up the applications at the church or go online to get the applications. And there's a telephone number on the application that you can call North Carolina MedAssist directly to answer any questions that you may have. And they're more than willing to work with anyone who wants to receive free medications. But the main office is in Charlotte, North Carolina.
Okay, great. So the main office is in Charlotte, but let me correct that website. It's actually www.medassist.org.
Right.
That's medassist.org.
Correct.
Wonderful, wonderful. So great program, doing great things in Eastern North Carolina.
Yes.
And helping individuals who, shouldn't have to make that decision between whether or not they purchase necessities like food or medication, because we know your health is extremely important. So the work that you're doing as the event chair of this event coming up in May sounds really, really interesting and very, very impactful. How did you get involved with this event?
I was very interested. I received an invitation to attend a luncheon by the staff from North Carolina MedAssist, and they met with women in Eastern North Carolina at Vidant Medical Center, and they told us about what they were doing, and we were all excited about the fact because we know people who would benefit from that, and anyone who's in the community. We're really concerned about the health of the community. We want to make sure that the people of Eastern North Carolina have every opportunity they need to be healthy. So we were asked to fill out a form if we were interested in participating, and of course I filled out the form. And then I was approached by a staff person from Charlotte asking me would I be interested in chairing this year's event, and I said yes because I have a passion for this. I've worked in mental health field, different things throughout my career, but I know the impact of people not being able to receive, number one, adequate health care, and number two, to get the medications that they need even if they go to the doctor, because oftentimes they're very expensive, and if they don't qualify for insurance or they don't have insurance and they don't qualify for Medicaid, that leaves them in a situation where they can't purchase those medications. Or for seniors who have Medicare, who have stipulations on their Medicare, either Part A or Part B, and they can't get certain medications, this is very helpful for them to ensure that they get the medications that they need.
I see. I see. So tell us about the luncheon. What can folks expect if they were to attend?
Oh my goodness, you're going to first get a wonderful meal. We are having the event at the Hilton. It is May 22nd from 11:30 until 1. And we will be recognizing 3 women in from Eastern North Carolina locally who have made contributions in the area of health. We had 7 nominees, and there will be 3, and it is a very difficult task because each of these women have made tremendous contributions to the health and welfare of people in Eastern North Carolina, particularly those who are underserved or socioeconomically or have not received the services maybe they could have received or needed to receive. These women were instrumental in making sure that this population received that help. So we will be recognizing those individuals. The luncheon is free. I have to say the luncheon is free, and if people are interested in attending the luncheon, they can also go to that website, or they can contact Gabrielle Baker, and the number is 252-531-4220, and she can register them for the event. Like I said, it's free, but it is a fundraiser.
Sure.
So it is a fundraiser. So even though there's no cost for attending the luncheon, it is for a good cause. It's to
Right.
raise money to make sure that we're able to serve the people of Eastern North Carolina. And it's a lunchtime event. It's not going to last long, but I believe that it'll be a very enjoyable event.
Wonderful. It sounds like it. I look forward to going online and registering myself
Yes.
so that I can be in attendance.
Yes, we'll be looking for your registration.
Yes, yes, yes. And so, folks, please be sure to register so they'll have a head count for the number of attendees. And again, you can register online at medassist.org. And it sounds like it's going to be a great event honoring women and recognizing women in the health field that has assisted those who may have needed that help, like as you stated, the vulnerable populations, those that are underrepresented. So can you talk a little bit about why the focus on women?
Because oftentimes women are in the background, and they do make a lot of contributions to the medical field. We will not only have women who will be attending this luncheon, it's open to anyone, because we're bringing together leaders and other experts and influencers so that they can see all the strides that have been made by these particular women. But women have made a tremendous impact. And that's why it's so difficult as far as selecting the nominees, because they've done everything from had clinics named after them to ensuring that certain population have needs met. They've been across the board providing services. So this year our emphasis is on women and the things that they have done for the people of Eastern North Carolina, and many of them outside of Eastern North Carolina.
Great. Well, this sounds like it's going to be a great event, a time that everyone can come and celebrate, but also raise awareness about what North Carolina Med-Assist is doing and also contribute to continue their efforts. So it's definitely something that I think will be a great opportunity for all of our listening audience to take advantage of and be a part of. But I know that it takes a lot of work.
Yes.
And it takes a lot of collaboration and a lot of partners. Do you have sponsors that are assisting you with this event?
Yes, at this point, Vidant Medical Center is one of our sponsors. They're assisting us. We have others, Sarah Lee and others that are coming on board, and we still have openings for people who want to sponsor the event. If they are interested in sponsoring the event, they will also need to contact Gabrielle, and she can tell them what they need to do to be a sponsor for the event, which, like I said, we're still looking for people who want to come out. Eastern Radiologist is also a sponsor for the event. So we have people who are really behind us to make sure that this comes off very well. And we know that it is. And we tell people in giving that for every $1 that is given at the event, $20 worth of medication is given. So if you give $10, you think about what impact that makes on a person's life. So we're asking people to just come and just give from their heart, knowing that it's going for a good cause and knowing that it's going to make a difference in their neighbors' lives. It may be people that they have contact with every day that they don't realize are having difficulties obtaining medications. Even physicians that prescribe medications oftentimes are concerned about whether or not their patients are able to even get the prescriptions or not. So they give generic or whatever they can do. But this way we can make sure that the people of Eastern North Carolina, and so we want to make sure that doctors' offices and places throughout the county in Eastern North Carolina know that MedAssist exists. So if they know that their patients need these prescriptions, they can say, this is a way you can get your medication and be comfortable that their patients are going to get the help that they need.
Great. So it sounds like you're inviting the medical community to
Yes.
come out and be a
Yes.
part of this. Those who want to support this great cause,
Yes.
those who see the need and the necessity of protecting the health of our North Carolinians. So thank you for sharing that. And I know that you have a great team behind you as well. Your committee is working with you on this event. Great.
We have a committee of 9 women, and they come from different walks of life. Some come from Vidant. We have someone from Edgecombe County, different places in the Eastern North Carolina, who are coming together, who are also very concerned and very excited about this possibility coming here and what it's going to mean for our neighbors and the people that live in Eastern North Carolina. So yes, it's a lot of work, but it's worthwhile. It's worth every moment that we're putting into it because we know this is going to benefit people in Eastern North Carolina.
Great. Well, in the beginning, you mentioned that you had done a lot of work in healthcare over your career. And so you have a lot of experience with working in this field. So it's very apropos that you would be the chairperson of this event. Can you tell us a little bit about what healthcare means to you and why you have such a passion for this field?
Well, my undergraduate degree at East Carolina was in community health, and I worked for 20 years in our area mental health center. And one of the things we saw was that mental health needs and physical needs often went hand in hand. One of the beauties that existed then was we ensured that our patients received their medications. But I do know that being able to get the adequate medications that a person needs has an impact on their lives, has an impact on their well-being. There was a story that was told of a case in Charlotte in which a young man was not able to get his medications and had some mental health issues and was homeless, as a matter of fact. And because he was able to get into the program, get his medications, believe it or not, he went back to school, completed school, and is doing very well right now. So that made a big difference in that person's life. If a person has high blood pressure and they don't feel like working because they can't get their medications, being able to get the medications they need to be able to hold down a full-time job or do what they need to do for their day-to-day lives, to enjoy their lives, not just to exist, but to enjoy their lives makes a big difference. It does.
Wonderful. And so now I understand that you are the associate pastor at Jarvis. So you're able to continue your mission of working with underserved populations.
I am the associate pastor there at Jarvis for Mission and Empowerment, something I truly enjoy. It's a wonderful opportunity. One of the focuses of Jarvis is to serve the community in the neighborhood where we are, because we are in downtown Greenville. And we have been moving further out into the community to meet with what we call our neighbors, to see how we can work with them, not telling them what they need, but what is it that we can do at Jarvis Memorial. And we do everything from working with our police department, with our first responders luncheon, working with our community shelter, Third Street School. We do have a Boys and Girls Club that is at Jarvis Memorial. So there's so much that's going on there at the church, and we intend to continue to move out into the community. So that's a passion of mine, working with people in the community. We see so many people that have needs, and we do the best that we can to meet those needs as much as possible. But we're going to be branching out even more to see how we can have an impact in the community.
Great. Well, that is definitely something that the Church's Outreach Network and the Community Insight broadcast loves to support. I understand you have a relationship with Pastor Coles,
Yes,
and you
I
know
do.
him.
Yes, we are friends. We are friends. We've known each other for a while, and I've always admired the work that he does in the community. And I've worked with him on some other things, whether it's Toys for Tots. We've worked together. He's had me as one of his shoppers. But as a matter of fact, Jarvis was the site for the Toys of Tots for the last couple of years. That was housed there at Jarvis for families to come in to be able to pick up the items that they need. So we've had that relationship and continue to hope to work together for the many things that are going on in the community, however we can help.
Absolutely. So we're talking about the 2019 Women in Health Luncheon that's taking place on Wednesday, May the 22nd, and it's from 11:30 to 1 p.m. at the Greenville Hilton. It is a free luncheon.
Yes.
So folks can come and learn a lot and fellowship and join in with the luncheon, but also you have an opportunity to contribute, an opportunity to be a helping hand and assist in the mission of North Carolina Med-Assist, which is to help those populations that are underinsured or don't have insurance and need that medication. Don't want to have them making that decision between purchasing food and buying medication. This program is in place to assist those individuals to get the medication that they need to ensure their health. So we'd love for you to come out and be a part of this luncheon. Please register. Register online at medassist.org. And can you also give Gabriel a call to also register?
Yes, they may call Gabrielle Baker. Her telephone number is 252-531-4220, and she'll be glad to take your information and register you for the event. If you haven't, we do have table hosts. I am also a table host, so I can be your table host, or any of the other committee members will be glad to have you as a table be at their table. But just make sure you register. The event is coming up. We're really excited, and we want to get people in so that they can see everything that's going on with North Carolina Med-Assist.
Great. And so register online or give Gabriel a call to let her know that you will be in attendance. And if you can't come to the luncheon, you can still donate and contribute to North Carolina Med-Assist. I'm sure Gabriel will be happy to assist you with that. Again, her phone number is 252-531-4220 if you're interested in sponsoring the event.
Yes, yes. We do need, like I said before, we do need sponsors. So if you're interested in sponsoring for the event, please call us. We are still taking sponsors for the event because, like I said, the main thing is we want to raise the money as we began startup in Eastern North Carolina for North Carolina Med-Assist. And as a reminder, every dollar that's given, $20 in medication is purchased goes toward prescription medications for people in Eastern North Carolina. So we really need people to come, be in attendance, see what's going on, hear about it. We will have staff from the Charlotte office who will be coming to be a part of the luncheon, the event. So we're asking people just to come. There'll be people hopefully from throughout the community, but we know that there are people out there who are interested in this, who care about people in Eastern North Carolina and want to be a part of this event.
Great. North Carolina Med-Assist is doing great work in Eastern North Carolina already. I actually attended a community health symposium maybe a month or so ago, and an individual was there passing out over-the-counter drugs that were very helpful to those. So again, when you had your mobile pharmacy, folks were able to get those over-the-counter medications and drugs, did not have to fill out an application, did not have to quote unquote be eligible to receive, but it was just available for the community. So there are a lot of great services that MedAssist is performing in our community. So please be a part and support this organization as they embark on this inaugural luncheon.
Okay. Thank you so very much. I appreciate it, and I just hope to see you there and many people there. If they have questions and they cannot reach Gabrielle, they can also give me a call, and I will try to answer any questions that they may have. They can reach me at my office at 252-752-3101.
Wonderful.
Thank you.
Thank you so much for joining us today. We've had a great opportunity to talk with Ms. Rhonda Grant Jordan, Reverend Rhonda Grant Jordan. We just appreciate your time in the community and all that you've been able to do to impact this community. And we just have a couple of moments here. So I wanted to speak with you just a moment about, again, your relationship with Pastor Coles. One thing I always ask folks is, how did you meet him? Because it's always a great story.
Oh, my goodness. I really can't remember because I've known him so long. I think I initially met him because I was also at one point the associate pastor at Cornerstone Baptist Church. And I think that's where initially I came in contact with him because we were doing things, whether giving out Thanksgiving baskets or anything to help in the community, and so I got to know him that way. But over time, we've maintained that relationship of getting to know each other. I even knew him when I was working at the hospital. He would come and meet with me and talk about things that we wanted to do in the community, and it's just gone from there. And it's been really exciting getting to know him, but to see what he is doing in the community. As a matter of fact, he does some things with Jarvis. We hope to have something coming up with him soon.
Wonderful. Well, thank you so much for joining us. And until next time.